Next, we have Holly Gammon. She's the manager of FASD programs at the Healthy Child Manitoba office in Winnipeg, Manitoba. She co-chairs the FASD Interdepartmental Committee that is responsible for the development and implementation of Manitoba's FASD strategy. Holly spent many years working within the Child and Family Services system prior to taking on this position.
Good evening, and thanks very much for this opportunity to speak. As Linda indicated, I work at Healthy Child Manitoba, which in itself is a strategy that is overseen by ministers of 10 governmental departments. And its vision is to work toward best outcomes for Manitoba's children, families, and communities. We have many programs within the strategy, and I wasn't supposed to push that yet, which work together to bring about this vision. And one piece of that strategy is the FASD strategy, a strategy within a strategy. And Healthy Child, because of that integration and interdepartmental work, is a very exciting place to work because it provides us with a very holistic and integrated approach to looking at the complexities within FASD. And through the Interdepartmental Committee, we have developed a 5-year strategy with 5 goals. But what I'd really like to talk about tonight is to share with you not the details of the strategy, but how extremely helpful this NAT has been to us in our work as we have participated in networking with this group over the last several years. Not only has it provided us with invaluable training opportunities, resources, and research, but it has also provided us with some of the real foundational pieces around which we ground our whole strategy. So what I have attempted to do is put together a bit of a diagram with the help of my evaluation coordinator, Kathy Andrew, to help explain this a little bit better. So at the center, we have the women and child, the individuals with FASD, our families and communities that we engage with. And we know that we can't just have them sitting there in the center, but we need to actively engage with them at all stages of service provision, whether it's when we are creating services, when we are trying to continually improve them, when we are evaluating them. They're always at the center. So when we look at the various goals of our strategy, the first 2 goals encompass FASD assessment and prevention. And what we are trying to do is we're trying to provide all levels of prevention, as Nancy showed in the 4 levels of prevention, and we're trying to improve on those all the time. The resource that's been developed around those 4 levels is absolutely wonderful, and we look at it and relook at it on a continual basis. It really helps us to ground our work. In Manitoba, we have done some surveys through our Liquor Commission and through the Free Press, and we believe that Manitobans have a fairly good understanding about the impacts of alcohol during pregnancy, but we still face major challenges around the stigma and the blaming and shaming of women. And their ability to feel comfortable in accessing services. So what we have tried to do is broaden our prevention efforts, which we hope will begin to pick away and rid ourselves of some of that stigma. One way that we do this is by connecting with other services that are supporting women who face many challenges, like mental health, addictions, income assistance, treatment services, etc. Because all of these services are integral to FASD prevention. They support us and help us. And we know that when we make improvements in and help women with getting proper nutrition, when we help women and support women around stress reduction, when we work with women in all sorts of capacities, we are really doing a piece of prevention because we know that those are mitigating factors in the risk of having a child with FASD. So our next strategy is around intervention, and I'll come back to that in a minute. Around research and evaluation, This not only looks at programs' effectiveness through quantitative methodology, but we know that we must seek to understand how to make improvements by listening to the voices of those that we work with. Our training and resources is our last goal of our strategy. And we try to ensure that all of our FASD-specific programs that we roll out have been provided with that grounding and work around trauma-informed practice. We also try and facilitate other trainings with systems like EIA education, and always with a focus in including that trauma-informed approach. And so all of these goals we see as connected and needing to work together and talk to one another so that we're all coming with a common voice. I'd like to provide at this time just 3 really quick examples of some really practical resources that have been of real assistance to us. So in research and evaluation, we have started down the road of our strategy evaluation, and even though members of this NAT are still working on the evaluation tools that we know are going to be so helpful to us, thank you, by the way, very much, we have already been able to start using those to ponder different approaches to our evaluation. We've always known that we wanted to look at evaluation from a very holistic perspective, and this initial mapping is really, really helping us. Another example of some very practical pieces that have been of assistance to us are around training and best practice skill development. We've had the opportunity to have trainers from this NAT, where we've met them through our networking, come and talk to us and provide really excellent training in a number of areas. Nancy came a couple of years ago and talked about improving policy and practice to support women and their children, exploring women-centered and trauma-informed approaches. We've had Linda and Betty come and talk to a whole variety of service providers around trauma-informed training. And Christine and Francis have come many, many times and are still coming again, I think next month, to provide motivational interviewing training, which is just like first rate. Also want to mention the 10 fundamental components of FASD prevention. We have really incorporated those 10 components into the very essence of our prevention programming in our Insight Mentoring Program and Project Choices. And the last example that I'd like to provide is the willingness and the support that we've had from NAT5 members to share and review some of the resources that we have produced. And one that it's just going through French translation right now and will be coming out in the next couple of weeks is one called Girls, Women, and Alcohol. And we've kind of used the one that was in BC here and adapted it for our own use. And just that kind of support is really, really helpful to us. We've also had many, many discussions, and NAT5 is so supportive in when we pick up the phone and say, for example, to Nancy, we've got this media request, or we've got someone that wants a briefing note for the premiers of Western Canada or something. What should we say and how should we go about this? And she's so willing to say, to help us and have a discussion with us around those issues and to really support the work that we're doing. So thank you all very, very much.